Anderson Cooper, AC 360, CNN weeknights 10 Eastern.
Keeping them honest, with 96 people waiting for life-saving transplants and one state governor who says, sorry, there's just no money to pay for them. We're talking about Arizona Governor Jan Brewer and 96 gravely ill constituents. 96 people no longer eligible for Medicaid-funded transplants. People like Francisco Felix, who's got 4 kids and needs a liver transplant. He was just hours away from surgery when he learned that Arizona's Medicaid program would no longer pay for it. Someone else got the liver. Francisco's still hanging in, but others have already died. Mark Price was the father of 6. He needed a bone marrow transplant. Doctors found a match, but it also happened to be on the same day that Arizona's Medicaid program stopped covering the procedure. He then had to scramble to find private financial help, which he did. Unfortunately, he died before the transplant could be done. Last week, a liver patient who was no longer eligible for Medicaid-funded transplant also died. The governor says cuts had to be made.
The state only has so much money, and we can only provide so many optional kinds of care, and those were one of the options that we had taken liberty to discard, to dismiss.
Well, states are strapped for cash, and Arizona is no exception, but it turns out that this entire crisis could have been avoided for just $1.2 million out of an $8.5 billion budget. Money Governor Brewer says she just couldn't find anywhere. We wanted to ask her about it last month when all this first broke. We invited her on the program. She declined, and her office sent us this email. Unfortunately, Governor Brewer is completely booked today and has an incredibly busy schedule throughout the remainder of December and into the first half of January. As she's booked with budget review heading into our upcoming legislative session, travel to D.C., her inauguration, and the State of the State. Again, we appreciate the invitation and your understanding. Let's touch base after the first of the year. Well, that sounds reasonable, right? What's funny, though, is the very next evening after we got that, after telling us that, Governor Brewer somehow found time to appear over on Fox News. Such is life. It's possible some time may be freed up at the last minute. Who knows? We're going to give her the benefit of the doubt. But what we can't do tonight is give her a pass on the facts. Facts matter. During that interview, Governor Brewer downplayed the effectiveness of bone marrow transplants.
Bone marrow transplants we still cover if it is a donor given from the family, meaning that if your sister would donate the marrow to you, because it's more of a successful rate. Those that are outside, generally, according to our records, we have that 14 bone marrow transplants have been utilized, and 13 of those people did not successfully live long afterwards. So, these are difficult decisions.
Well, difficult decisions, no doubt about it. But by pointing out 13 bad outcomes, the governor was suggesting that the outlook for bone marrow transplants is by and large bleak. Well, that's simply not true. In a letter to Governor Brewer, Dr. Jeffrey Schreiber, who runs Arizona's largest adult bone marrow transplant center, writes, our data was virtually identical to the national data, with 42% alive and apparently cured of their disease. Now, 42% isn't perfection, but it's a far cry from the 1 in 14 that Governor Brewer mentioned there. And then there's this comment.
But a lot of transplants are still being provided in the state of Arizona.
By the state of Arizona or privately?
By the state of Arizona. The bottom line is that we still provide, even with the cuts, heart transplants, liver transplants, kidney transplants, pancreas and kidney transplants.
That's not completely true. Liver transplants are not fully covered under the new system. A patient who died last week, for instance, was denied funding for a transplant because he had hepatitis C. Under the old rules, he would have been eligible and might be alive. As for Governor Brewer and the Arizona legislature, how they arrived at the new rules, transplant groups say they used outdated, even faulty data. For instance, lung transplants were cut out entirely because Arizona's version of Medicaid said data showed the surgery did not extend life expectancy. According to UStransplant.org, though, which provides the national report card for all major organ transplants, about 66% of patients survive at least 3 years after having the transplant. So the governor's science may be outdated and some of her statements didn't fit the facts. But what about the $1.2 million? She claims to be open to suggestions for alternative funding. Turns out she did get some ideas back in September. Representatives from transplant programs at 4 Arizona hospitals wrote her offering cost-cutting measures. Democratic state lawmakers have suggested dipping into federal stimulus money, $30 million, they say. But they say Governor Brewer has been vague about how much, if any, of that money is left. Some has already gone to fixing the roof on a rarely used coliseum. And enough money has been spent on algae research to fund the transplant program 2 times over. 5 families dropped from the transplant list. They've gotten so fed up, they launched a website to show just how much money's out there. They say they have identified $2.1 million from Arizona's portion of the settlement with AIG, $6 million in unclaimed lottery prizes. And get this, $1.25 million left over from a recently canceled project to build a bridge to save 250 squirrels. Not people, squirrels.